Thank you, Chair Murray. I appreciate having this hearing today and appreciate being able again to start this process with you as we did last week in our first hearing last week. I'm certainly glad that Dr. Collins and the Institute directors are here with us today. I think two of the directors are testifying before the committee the first time, and so welcome to the two of you. And this is a helpful relationship for us and hopefully for you. Certainly the challenges we've faced over the past year have been unanticipated and significant. I think the global pandemic reinforced the importance of the National Institutes of Health. In less than a year, NIH was able to take this novel coronavirus and help develop two FDA-authorized vaccines, two FDA-authorized therapeutics, and 16 rapid diagnostic tests, including the first FDA-authorized point-of-care diagnostic test for COVID-19 to combat its spread and its effects. A year ago, when we would have had a similar discussion, one of the big topics would be, why can't we get enough tests? NIH stepped up and really played a big role in seeing that we had enough tests. We haven't heard that discussion for a long time, and that doesn't mean that millions of tests aren't being taken every day. It just means we figured out at this committee and NIH to be part of meeting that need. It was revolutionary to watch NIH work, but it didn't just happen. In a time of crisis, during shutdowns, during social distancing, dealing with the disease that had never been seen before, the system and its nationwide grantees were able to use their expertise and infrastructure to, again, develop tests, treatments, and vaccines. Our research infrastructure was tested like never before, and in my opinion, it succeeded in remarkable ways. I believe there are really three reasons for that. First, in the past 6 years, this committee and the Congress, in a bicameral, bipartisan way, have prioritized and invested in NIH. Within that 6-year time frame, funding for medical research increased by almost $13 billion, or nearly 34% over that 6 years after a decade at virtual level funding. This investment encouraged young scientists, young researchers, and mid-career researchers that were leaving the field before that to stay in the field. And with your insistence, Dr. Collins, some of that money every time was set aside to be sure that it was going to first-time grantees. We were able to shore up the research infrastructure across the country and provide research into mRNA, an idea that had never produced a vaccine before, and of course became the foundation for the two principal vaccines that were developed very much with the involvement of NIH. Our ability to pivot so quickly and so successfully to fighting COVID-19 could not have been accomplished had we stayed at the funding levels we were at 7 years ago. The buying power was not where it needed to be. Young researchers were leaving the field. Tough budgetary decisions meant that people were not only getting their applications rejected at significant levels, they just frankly stopped making a lot of applications. That's not your problem, by the way, today. Second, at the height of the pandemic, Congress gave the Department of Health and Human Services significant funding and flexibility to create Operation Warp Speed. It was successful in developing two FDA-authorized COVID-19 vaccines and commercializing another with the help of NIH, because we united in our effort to make that happen. One of the things we did was to really invest in vaccines that we didn't think were certain to work, but thought were likely to work. And that meant that vaccines were available when they got FDA approval rather than months after they got FDA approval. Because of that, fully half of all adults have been vaccinated now in the United States as we work toward a bigger number than that. We pushed private industry and worked with private industry in ways we had not before. I've said at the time, one way to win the horse race is to bet on all the horses. And I think to a great extent we did in the vaccine effort, bet on all the horses we thought had a chance to finish the race, and it made a difference. Finally, one of the most important lessons learned from the pandemic is the value of having the federal government on occasion as a more active partner in research and development instead of just a sponsor. The ambitious speed and goals that push private companies to research, develop, and manufacture a COVID vaccine, 19 vaccine, along with what we did in testing, really created the kind of breakthroughs we needed. RADx, warp speed, I think put us in a different place than we would have been 2 years ago in thinking about how we can look at some of our research efforts in another way. That's why I want to work with the administration to support the ARPA-H initiative. This will be a new institute, or is proposed to be a new institute, and I think that's what should be the case. They'll have the flexibility and tools necessary to both nimbly and innovatively respond to both the next pandemic and also some of the big health issues we face today. This is a critical moment in a rapidly changing healthcare world. Finding those things that the kind of warp speed, Shark Tank, RADx relationship could enhance in cancer, in Alzheimer's, in every disease where there's an opportunity, where we see that moment and know that this is something that doesn't necessarily call for a 5-year research grant, but some sort of partnership different than that moves toward a real conclusion sooner than we might otherwise be able to do that. ARPA-H should not do what the other institutes do, but it should do what the other institutes can't do in a cross-cutting way that goes throughout the institutes, looking for opportunities, frankly, in the other institutes where there's a breakthrough moment that we could look at differently. I think we can help fill gaps here that otherwise would not be filled, and look forward to that discussion. Now, also as someone working with Senator Murray for the last 8 years to increase the funding and the focus in what NIH has been doing, we clearly want to be sure that this somehow doesn't take away from the solid research that proves so effective in getting us ready for what we just saw. Dr. Collins, I look forward to working with you and Chair Murray and the administration in making ARPA-H a reality. I think there's a moment is ready for that. I think because of what's happened in the last 2 years, NIH is ready for that, and look forward to the discussion today.